Hi, this is Dr. Beltry from Beltry Bariatrics, and today I'm going to be talking about the duodenal switch. This is a quick drawing of the biliopancreatic diversion with duodenal switch. This is the classic one, right? We do not do this one in the United States as much anymore. We do the one that we refer to as the single anastomosis duodenal switch, or the SIPS, S-I-P-S, that's the one I'm going to be talking about. But I just wanted to show this just for historic perspective, so that you have an idea of the classical duodenal switch. Again, we don't do this one as much anymore in the United States. We do the single anastomosis duodenal switch. And for me to explain the single anastomosis duodenal switch, I have to first show you a drawing of the gastric sleeve, because the duodenal switch has two components, right? The duodenal switch has a sleeve component and then a bypass of the intestine. So when you think of the duodenal switch, or the SIPS, think of two surgery: a sleeve with a small bypass of the small intestine. So you can think of it as a combination of the sleeve and the gastric bypass, if you will. Here is the gastric sleeve, right? When we do a duodenal switch, or the SIPS, we do the sleeve the way we always do the sleeve. But then if you notice, at the very end of the gastric sleeve, the small intestines begin, right? The small intestine has two components, two parts. It has the upper half, which is called jejunum, and the bottom half, which is called ileum. What we do, we disconnect the gastric sleeve from the upper part of the intestines, called the jejunum, bypass the upper part of the intestine, but then reconnect it to the bottom half, therefore bypassing the upper half. That's a single anastomosis duodenal switch, and normally the connections is about halfway, about 300 centimeters from the very end here. Okay, we bring it up and reconnect it here, bypassing the very top. This is the single anastomosis duodenal switch, the SIPS, which is the third most commonly done weight loss procedure, right? The first most commonly done procedure is the gastric sleeve by itself. Second one, a close second, is the gastric bypass. A third is the duodenal switch, the single anastomosis duodenal switch, or SIPS, that is gaining more popularity because it's the most potent bariatric procedures or weight loss procedure. The SIPS, or the single anastomosis duodenal switch, is done laparoscopically or robotically, right? So small incisions, just the way we do the sleeve, just the way we do the gastric bypass. About 5 to 6 small incisions. The biggest incision is less than half an inch, which we try to hide in the belly button. The other ones are about diameter of a pencil, 5 millimeters. So depending how you heal, you hardly see anything. The SIPS, or the single anastomosis duodenal switch, takes about an hour and a half, 2 hours to perform. And basically, like I said before, the surgery has two components. It has the gastric sleeve, or the sleeve gastrectomy, done the way we normally do the sleeve gastrectomy. Then we disconnect the sleeve from the small intestines and then reconnect it halfway, 300 centimeters from the end of the intestines here. We reconnect to the sleeve, therefore bypassing the upper part of the intestine. So what does that give you? That gives you several components for weight loss. Number one, you have portion control, right? You have the sleeve component. So the stomach is smaller, you eat less. Number two, you have the appetite control, right? We are removing the segment of the stomach the way we do with the sleeve. We're removing the fundus, which is the segment where ghrelin is made. Ghrelin is the hunger hormone, right? So now you have a hunger control. Number three, you're taking advantage of the foregut theory. Remember the foregut theory, which states basically that when you bypass the upper part of the intestine, the foregut, the forward gut, right, the upper part of the intestine, in this case the jejunum, that causes release of even more potent metabolic hormones. There's a more metabolic component. Also takes advantage of the hindgut, which means that when you are bringing food to the distal small intestines, you even get more of a release of hormones. So those are the four things that are working with this surgery. So with the single anastomosis duodenal switch, you have everything that can potentially work for someone to lose weight and get rid of certain diseases working for them. Smaller stomach for portion control, the ghrelin effect, and then the foregut and hindgut theory, which helps you release a bunch of hormones that help get rid of type 2 diabetes. So for example, with the gastric bypass, you can stop type 2 diabetes up to about 90% of the time. With this procedure, with the single anastomosis duodenal switch, you're talking about stopping type 2 diabetes 98%, 95%, 98% of the time, right? No matter almost how long you've been a type 2 diabetic. So it's very powerful. Weight loss also with the duodenal switch is anywhere between 15 to 30 pounds the first month. Then after that, you're going to be losing 8, 10 a month more consistently. Duodenal switch patients lose the most amount of weight. They tend to have less weight regain with the surgery because of the hormonal components, because their appetite control seems to be more long-term, right? A duodenal switch patient will tell you they have excellent appetite control and almost never comes back. So it is the procedure with the least amount of weight regain. So works best in terms of weight loss and control of your diabetes. High blood pressure goes away fairly quickly. High cholesterol, sleep apnea, anything related to obesity will get better almost immediately with the duodenal switch or the single anastomosis duodenal switch. Those are some of the pros with the duodenal switch. What are some of the cons with the duodenal switch? Well, the duodenal switch, number one, vitamin deficiency. It can be even more common down with the gastric bypass. It's very, very important that individuals take the bariatric multivitamins, including iron, B12. They need to vitamin D3, very important. In addition to that, you need to take your fat-soluble multivitamins, right? Vitamin A, D, E, and K. A, D, E, and K, which are the fat-soluble multivitamins, need to be taken in addition to your regular bariatric multivitamins with the single anastomosis duodenal switch, so that you don't become deficient in these multivitamins. One of the difference between the gastric bypass I find and the duodenal switch is that, remember, I talked about potential bowel obstruction with the gastric bypass from internal hernias. You don't see it as much with the duodenal switch. It doesn't mean it doesn't happen, but it's much, much less than with the duodenal switch or the single anastomosis duodenal switch. Also, if you remember, if you look at my gastric bypass video, I talked about marginal ulcers in smokers. Duodenal switch patients don't get as much marginal ulcers, very few actually, and you don't see that much issue with ulcers that you see with the gastric bypass patient in the duodenal switch patient. So in that respect, the duodenal switch, it's a little better for smokers, if you will, because you will not see as much of their ulcers. The single anastomosis duodenal switch, I believe, is the best procedure to rescue someone that regained their weight from his gastric sleeve, right? Someone that comes to me and say, I got a gastric sleeve years ago, I regained a lot of the weight back, most of the way back. What is my best option? Well, if there's no severe acid reflux, your best option is with a duodenal switch, a single anastomosis duodenal switch. The sleeve part is already done. Basically, what you do is just disconnect the sleeve from the small intestines and reconnect it halfway down, 300 centimeters from the very end here. And patients begin to start losing weight again. So it's a great procedure to rescue someone that is regaining the weight from a gastric sleeve. So the duodenal switch is a great procedure, works really well. Again, it's not a magic solution, it's a tool. It still needs to be combined with good eating habits. Definitely needs to take your multivitamins to prevent vitamin deficiency, because the duodenal switch has the highest potential for vitamin deficiency. One thing I did not also mention, you can have more chronic diarrhea with the duodenal switch. And because we are bypassing the upper part of the intestines, if we bypass that too much, you can have chronic diarrhea. Some people, you can do it just right at 300 centimeters and still they can have diarrhea. Sometimes diarrhea can get better over time. Sometimes it does not, and we need to reoperate on those individuals and give them more, give them backbone intestines to make the diarrhea go away. The duodenal switch is definitely more metabolically involved, if you will, than the sleeve or the gastric bypass by themselves. So single anastomosis duodenal switch, combination of the sleeve and bypass of the small intestine works really well. It is the most potent weight loss or metabolic procedure there is. You get the most weight loss with it, less chance of weight regain. But again, potential metabolic risk of chronic diarrhea, vitamin deficiency. Taking your multivitamins is very, very important with this procedure. Less chance of marginal ulcers, however, with the duodenal switch compared to the gastric bypass in that sense. So it's really good procedure. Who gets duodenal switches? Patients that had a gastric sleeve failed on them, or patients that are very uncontrollable type 2 diabetes and had it for years, 6, 7, 8 years type 2 diabetes, now taking injections of insulin and other medications, would be better served with the duodenal single anastomosis duodenal switch. The great thing about the single anastomosis duodenal switch that I love is that you can do it in two parts. You can do the sleeve component first, right? Do the sleeve first, wait a few months, and then go back and do the small bowel bypass second. And they still have great result from this procedure. So you can do it in part. So great procedure. Personally, one of my favorite, because I see less weight regain, better appetite control with the single anastomosis duodenal switch, otherwise called SIPS, SIPS. So works really well. I hope this information helps you to make a decision about obesity procedures. Again, this is Dr. Belcher from Belcher Bariatrics. Thank you.